Madam Chair, Commissioners, and the State Committee following all these resolutions today. This resolution came out of the Commission on Mental Health. We had a wonderful segment on tobacco use in people who have mental illness and how that tobacco use affects the brain. We thought that one of the least things that we can do is to pursue plans to reduce tobacco use in facilities operated by the MHA and facilities that receive funding from the MHA. That's what the resolution does, and I appreciate your help.
Any other questions for Senator Lawson? All right, we'll move to testimony. Dr. Kelly.
Madam Chairman, members of the committee, my name is Jeffrey Kellums. I'm a professor of clinical psychiatry in the University School of Medicine, Department of Psychiatry, medical director of the Midtown Mental Health Center, director of psychiatric services at First Hospital, and the chairman of the Board of Mental Health America, and had a record of 40 years of psychiatric practice. Tobacco is a significant issue for 80% of 17,000 clients that I help to serve at the Midtown Mental Health Center. It is a problem for all of us. 40% of the sales are to those with mental illness, and it does contribute to multiple medical issues that arise as a result of tobacco addiction. Nicotine is equally as addictive as cocaine. Most people do not know that. Certain clients do not know that. The average patient who is smoking one pack of cigarettes per day at a rate of $5 per pack, and the math comes out to about $1,800 per year. If we're taking 2 packs per day, it's $3,600. At Midtown, we are already launching a program by working with Tom Lux and Rethinking Tobacco to address the tobacco issue that we see in our clients. As clinicians, we have tended to ignore this addiction issue and assume that it's simply part of the American culture. It quite simply is not and does not have to be. It is instead a careful crafted deception on the part of the American Tobacco Institute and tobacco industry. The time has come for us as clinicians and as mental health centers to address the tobacco usage head on by supporting Resolution 7 by identifying the addiction clients and providing adequate treatment for them. Any questions?
Other questions? Senator Lawson, may you go on the microphone? Hey, I just wanted to ask a question on this lady compared to my former smoker. But I've been free of addiction for 15 years, but I just wonder what kind of ventures that you are going to engage in to free people of this addiction. I mean, I know a lot of people who absolutely try to do it, and I think the percentage of the release of the habit is extremely low. Also, I have clarifying on this, is there some indication that interactive people can serve as a way of maybe a contact on people that just want to know how they can.
Yes, thank you very much. It does have some common effect in some individuals who use nicotine. There's no doubt about that. The problem, of course, is the repercussions of long-term use of nicotine. As far as our program, we will be working with Tom Lux and Rethinking America, or Rethinking the Tobacco in America, and we are going to be putting into place psychosocial programming, which will involve individual therapy with patients as well as group therapy. We will also utilizing some new chemical treatments that are available for tobacco addiction, Chantix, lozenge, tablets. There are many different items that we can now down in about 90 days, where it's going to be a long-term project, but we will start somewhere and be very aggressive at it.
Are there any other questions for Dr. Collins? Thank you, Doctor. Dr. Chambers. Not here. All right. We'll move on into complex.
Madam Chairman, members of the committee. My name is Tom Lux. I'm the director of Rethink Tobacco, a program of Mental Health America of Indiana. I'm here to support resolution number 7. Tobacco causes 440,000 premature preventable deaths in the U.S. each year. 49 million Americans still smoke, and 1.1 million Hoosier adults still smoke. 9,800 Hoosiers die prematurely from preventable tobacco-related disease each year in Indiana. That's 27 every day. In addition to the pain and suffering for individuals and their families, the medical tab for tobacco-related disease in Indiana is huge, $2 billion per year. The Medicaid portion of this medical treatment for tobacco-related disease is nearly $500 billion per year to Indiana taxpayers. We now have the second highest smoking rate of any state in the United States at 26% of adults smoking. And as high as that rate is, 31% above the national average of 19.8%, the rates of smoking among those with mental and addictive illness is 3 times that high, at 75%. We cannot bring the Indiana smoking rate down unless we deliver the tobacco dependence treatment services to the populations with the highest smoking rates. Testimony presented to the Mental Health Commission in these chambers on October 20th by Dr. Jill Williams, one of the foremost addiction psychiatrists and tobacco treatment specialists in the U.S., reinforced the fact that individuals with mental illness want to quit smoking. They can quit smoking, but they need structured nicotine-dependent treatment in order to quit and make that transition. This is not a matter of willpower. We applaud the individuals who have been able to quit their tobacco habits without structured treatment, but evidence points to the fact that of those 49 million remaining smokers in the U.S., they are our most hardened nicotine addicts. We know where a large percentage of these tobacco users are. They pass through our mental health and addiction centers every day. Our mental health counselors have the skills to treat nicotine addiction, but the culture in our psychiatric hospitals and mental health clinics have traditionally minimized and ignored tobacco dependence in its patient populations. Your passage of this resolution can lead to a significant reduction in the smoking rates of this vulnerable population, and by doing so, lower the overall smoking rate for the state of Indiana. Carl Sneakus, the Executive Director of Indiana Tobacco Prevention and Cessation, could not be here this morning, but she also wanted me to pass on the commitment of ITPC to support the NHA in the development of these new policies and also the training of clinicians to provide these very important tobacco dependence services to the NHA clients. Please support resolution number 7, and thank you very much for your time.
Thank you. Are there any questions or comments? The chair is at this time, chair will retain this position of resolution. Does it start out? Is there a second? All those in favor signify by saying aye. Aye. Opposed? All right. Thank you very much. Thank you, Senator Watson. You've had a good morning.